Hello everyone, my name is Jimin Han, and today I will present on treatment for atopic dermatitis. I have lived with atopic dermatitis for more than 20 years, which naturally led me to become very interested in newly developed therapies, and that is why I chose this topic. First of all, atopic dermatitis is caused by an overactive immune responses. And for many patients with moderate to severe symptoms, the traditional systemic treatment is cyclosporin, an immunosuppressant, which I have also. Cyclosporin reduces the deactivation of T cells, which lowers inflammation and itching. However, this broad immune suppression causes side effects such as nephrotoxicity, hypertension, astigmatism. To overcome this limitation, several new targeted therapies have been introduced. Today, I will introduce two major types, Dupixent and JAK inhibitors. Dupixent is provided in a prefilled syringe. Dupixent works by blocking signaling from IL-4 and IL-13. These cytokines activate immune pathways that cause inflammation. Cells have receptors for IL-4 and IL-13. When these cytokines bind to their receptors, they trigger downstream signaling that results in allergic symptoms. Dupixent blocks the IL-4 receptor alpha, preventing IL-4 and IL-13 from delivering their signals. For example, IL-4 activates B cells to produce IgE, which then activates mast cells and causes itching and redness. By blocking this pathway, Dupixent reduces allergic inflammation. One common side effect of Dupixent in conjunctivitis, which is caused by eye infection. JAK inhibitors are taken orally, which is a little pill, and they work by blocking the JAK pathway, which is activated after cytokines bind to receptors, which mean including IL-4 and IL-13 signaling. However, the JAK pathway is involved in many different immune responses, not just IL-4 signaling. Therefore, JAK inhibitors can have broader systemic effects and potentially more side effects compared to Dupixent. As a result, JAK inhibitors act later than Dupixent, but because their range of action is much more broader, they can produce greater effects as well as more side effects. JAK inhibitors can cause side effects such as headaches, increase cholesterol level, and a higher risk of infections. Then you may wonder why I am not currently using Dupixent or JAK inhibitors. The reason is quite simple, cost. In Korea, Dupixent costs around 1 million won per month, and JAK inhibitors cost around 700,000 won per a month. My current treatment is cyclosporin and antihistamines. It cost only 60,000 won per a month, which makes a huge difference. I truly hope that one day a treatment will be discovered that can completely cure this disease. Thank you for your attention. If you have any question or feedback about the video, please feel free to share them. Your feedback will help me create better videos in the future. Thank you.